All right. Good evening, everyone. Thank you very much, or good morning, whenever you're listening to this. Thank you very much for joining us for a part two to our interview tip series. My name is Adam Ahmed. I'm a member of the TSMA, and today we're very lucky to welcome Dr. Sara Pereira with us. Dr. Pereira is a professor of surgery at the University of Utah and joined the Division of Cardiothoracic Surgery in 2020. She completed her residency in general surgery at the University of Cincinnati College of Medicine and fellowship in cardiothoracic surgery at the University of Alabama. She spent 10 years working in private practice in Colorado before returning to academic medicine. She's currently the program director of the integrated and traditional cardiothoracic surgery training programs at the University of Utah, and she's a champion of resident education, diversity, equity, and inclusion in surgery. It is always a pleasure to have you with us. How are you, Dr. Pereira?
I'm great, Adam. Thanks for having me. I'm really sorry to miss the superstar session last Friday. So thanks
Well,
and great job with everything you're doing with TSMA.
much appreciated. So we were thinking maybe starting with just some general advice you have for students. They just got their interview, they're nervous, they're going on Google, they're searching things up. How do you advise us to start prepping for our interviews when we first get that offer?
Yeah, that's a great question. I think I like to approach interviews like a mutual getting to know each other session. And I think with virtual interviews, all of us saw that folks were actually a little bit more nervous and more rehearsed for interviews than when we had in-person interviews. And so I do think a lot of integrated programs are trying to go back to in-person interviews, both for you to get a feel of the place and for faculty to get a feel for you. I also think that every time you interview in your life, I think the questions will be similar. And so the questions I like to ask, I've learned from being on the medical school admission committee, general surgery interviews, and from fellowship and integrated interviews. And I think most programs approach interviews in a holistic fashion these days.
Wonderful. So I think one of the first questions that throws a lot of people off is when you walk in and they ask us, tell us about yourself. How should we address that?
Yeah, tell us about yourself is the most anxiety producing question because the more you rehearse it, the worse it gets, I think. And so in my mind, I like to think what makes this person unique and or a good fit for our program and what makes me want to train this person. And so to me, tell us about yourself just means, hey, I'm Sarah. I grew this interest in cardiac surgery through X experiences. And I'm really interested in your program because that would be something easy to say if you're a private person. I tend to be a real introvert, so I'm not really good at pulling out pieces of myself that makes me advertise the tell me about yourself. Even for me, when I've interviewed in the past, I think it's really hard. And so I think just think about what really inspires you to be a cardiac or thoracic surgeon and why you're sitting in the interview. And then just say something that comes to your heart that makes people want to know you further.
Do you think there's a right amount of length that the answer should be before it starts to seem too rehearsed or too dragged out?
I think maybe a minute at most, or maybe five, six sentences. You don't want to take over the screen or the interview with telling the interviewer about yourself. You don't want it to take 5 minutes because you want to get to the next question, but it's meant to be an icebreaker. And it's good to get positive body language. It's good to smile or, move around a little, not be too rehearsed. Um, because I think that just makes you seem more like a person instead of kind of like a robotic interview figure. And so, if you say where you grew up, um, what interested you in medicine, and what inspires you to be a cardiac surgeon, I think that would be a really good answer. If you say, you're interested in going to this program because that would be a good answer. But you don't want to go through your whole life and make it 10 minutes.
Right. I've been prone to do that in the past. Good.
Extroverts tend to talk too much, and the introverts tend to say nothing, right? And
Yeah.
so somewhere in between there is the right answer. And there's actually no right answer,
Right.
right? So you should know that there's no right answer to any interview question. I think people are just trying to get to know you and to see what makes you tick and to see what motivates you. And the best conversations are the conversations that you just have where you run out of questions or you don't get to the next question, where you're just kind of talking to someone like they're a colleague. And
Mhm.
if you have an interview where they don't ask you any hard questions, then you probably know that you're already in and they already love you. But if they go through every single hard question on the list, I think you should talk a little bit longer with each question,
Right.
instead of being too short,
Yeah.
if that makes sense.
No, definitely. And the I guess that's also part of like the interviewing skills, like knowing how to pause, knowing how to, take those, moments to have your answer really hold strong. Like, do you have any tips for that?
I think it's always great to pause, right? So there's this great term that everybody looks for called emotional intelligence. And emotional intelligence really means that you're able to kind of read the room whenever you walk into a situation, and that you talk with a little bit of a filter perhaps at times instead of just jumping on answers really quick or interrupting people. And so all of us know that great surgical leaders have really high emotional intelligence. And trust me, I've been practicing for years to be better at it. Um, but yeah, I think it's great to pause. Or if you don't really understand their question, you can definitely pause and ask for clarification. If you get nervous and forget their question, you can say, I'm sorry, I missed part of that question. Could you please repeat it? Or I'm sorry, I don't understand that question. So that just tells people that you're paying attention, that you're interested in really hearing what they have to say. And I think it's good to have pauses. Or if you want to correct an answer, it's good to correct an answer. It just shows that you're really paying attention.
Right. So, moving on from tell us about yourself. Now, usually the flip question is you telling them about the why this program and sort of finding a way to connect your I guess your goals and your skills with that program. How do we tackle the why this program question?
I would encourage everyone to know a little bit about the background of the program. I wouldn't spend too much time on it because if you spend too much time on it, it may look as if, I don't know what the right word is, but if you spend too much time on studying a program, it's almost that you're quizzing the person that's interviewing you. And so, if you get a list of who's interviewing you the day before, my suggestion would just be to look and see what their specialty is on their webpage and to have just two or three questions. So you can have two or three questions that you can tape to your computer screen. And if they're always going to end with, do you have any questions? Um, if you don't run out of time, they'll ask you if you have any questions. And so if you have just a couple questions, either unique to that program or unique to their specialty, I think that'll really help. So for instance, if a program has a research option, you can say, I noticed that you had a research option. I'm really interested in doing A, B, or C. And then you can ask them what the opportunities are to get an advanced degree or what the opportunities are, in the field of innovation or structural or, chest wall. I think that just shows that you've researched the program a little bit, and then it also shows your interests.
Mhm. What? would you advise students ask questions about perhaps the culture of the program or the like how the residents interact with one another, things like that, or try to keep it more strictly objective questions about the curriculum, time off, etc.
Wow, that's a great question, actually. I can say that in all of the times that I've interviewed over the past 10 years, I don't think anybody's ever really asked me about the culture. And I don't think anybody's ever specifically asked me about the curriculum. Now, maybe I'm not a great interviewer in that, or that we just get to talking about other things of interest. But I think you have to assume that most integrated programs and most general surgery programs have essentially a similar curriculum because we all have, operative requirements or case requirements. I think you could ask about the centers that you would rotate at.
Mhm.
You could ask about teaching styles, perhaps. So, one question that interviewers might like to ask is, what is your preferred teaching style if you're teaching a medical student to suture, or um, within the education field, what have you found most effective in terms of your teaching or your learning? So you could turn that kind of a question back to faculty with asking them about their teaching style. Um, I guess I would try to avoid the word culture in an interview just because culture is a hard thing to explain. It's kind of more a feel.
Mhm.
And so I would ask those questions to the residents
Understood.
because I think the residents would be able to really tell you about their experiences. And so I always encourage people to ask the residents about the cases they did that week, the culture of the operating room. And I think if you ask the faculty about that, they may assume something either negative or positive that you don't want them to assume. And so the residents are going to tell it to you straight. They don't have anything to hide.
Mhm. And some interviews they do the social the night before with the residents, which is always a nice experience where you get to have these one-on-one conversations. Do you have any tips for prepping for the social? Is there anything we should be, or is that really just a time to get a feel, have a good time, and really, not worry about the interview until the next morning?
So I think the number one most important part of choosing where you want to go for residency is the people. I personally really feel that way. I think it's the same as when you take a job someday. I think the people are more important than the location. I think the people are more important than doing 6 years or 7 years or 8 years. And definitely, I mean, if you're happy at the program, that's a lot more important than the geography of it. And so the social event is really for you to get a feel of the people, to me. I think, I mean, I always tell our residents and fellows to, figure out about people's hobbies and what they like to do and what drives them and just get a sense of people's personalities. Because people who are happiest in residency that don't burn out have a lot of support. And in order to have a lot of support in residency, you have to like each other. And so I could tell you that every single one of our residents and fellows in Utah is really different. Every single one of them, they come from different walks of life and different places and different experiences. Yet I think they all really like each other. And so it's kind of, you really want to, ask them the hard questions. Say, what do you do in the operating room? Who are the best faculty to teach? What's your typical day? What's your call schedule? You can ask them those questions.
Mhm.
And I think that's totally valid. And then you can ask them, what do you do on the side? You get together outside of the hospital,
Yeah.
and then you kind of figure out, your fit within that group of people. And
Mm.
that's really important.
Where would this also be an appropriate time to ask maybe about the city itself and living? I had a mentor say, ask them about parking, ask them about traffic in the city, like during the social, kind of to get a feel for the city. Is that something
Yeah,
you?
absolutely. If you're virtual and you've never been there, yeah. I
Mm,
mean, integrated residency is long, right? So is general surgery. I mean, I went to Cincinnati for general surgery. I was super naive. I grew up in California. The culture, honestly, was like black and white from what I was used to. And I wasn't smart enough back then to know to ask about the city or to see myself there, And I had great training. Don't get me wrong. I loved my surgery training. I had great training. But I think if I was smarter back then, I would have asked those hard questions of what do you do outside of work? Um, I mean, I had no idea it was 20 degrees all winter. I just thought I could go run. So, those are the little things that I think you can pick up on when you go in person and that's why we do a lot of different mock orals and interview practice because I do think it's important to try to figure out, this is a long chunk of your life and if you really like the people and the training, you'll be really successful.
mm. So speaking of mock interviews and while we're starting to prep for questions, are there questions that you like to ask people or questions that you think that we should start to prep for, keep in the back of our mind right now?
Yeah, so I think people who are attracted to surgery come from different experiences, but I think in general, people who are attracted to surgery are prior athletes or musicians or Eagle Scouts or people who are used to being on teams. Um, and I think to be a successful surgeon, you have to be really resilient because you have days that are really hard. So even if you're a great surgeon, even if you're, Joe Caselli or, I can't think of all the names of my idols right now, but like, the pioneers in surgery had bad days, right? So how you bounce back as a resident really will indicate how successful you are. So I think have an answer for the question that says, tell us about your biggest challenge, or tell me what your largest failure was, in the last 5 or 10 years or in life. And then the interviewer really wants to know what you've learned from it. And I think it can be anything. I think the faculty always debriefs after interviews, right? So if somebody says something kind of silly for that, like your largest failure was you got a B, then that we don't really think that's a big failure, right? So you want to have something that really impacted your life, whether it be a childhood experience or applying to medical school 4 times or, having to resubmit your research paper 6 times. You want to have something that just says that you've not had a perfect life, that you've faced challenges, and that you've bounced back from it. And the next time you haven't made the same mistake. And I
Mm,
think that's one of my favorite questions. I really like to know how students and residents envision their first job. So, what I mean by this is, I think people want to know what you've thought about. You know, if you're interviewing for a community general surgery program and you go on there and you tell them you want to be a chair of surgery and you want to publish 200 papers, then that's not going to line up, right? So if you're interviewing for a community general surgery program, I would be prepared to have an answer that tells them that you've really thought about why you want to train in a community general surgery program and how your first job looks. And, that could be anything from, giving back to your community to practicing a wide breadth of cases. You could do cardiac and thoracic in the community. You could be in a remote area where there aren't as many surgeons, and you could be the person that serves that whole area. Versus if you're interviewing for a really large academic program, then I think you really want to tailor your answer to academic surgery. I don't want you to be dishonest, but I do want you to think about it because the odds are that the large academic programs really want to train people that um, want to stay in academics and or subspecialize in an area, such as congenital or something else. And so I think if you give a really black and white answer that doesn't match with the program you're interviewing with, I think that there will be some red flags that you just haven't thought about it.
Mhm. So I'm sorry if this is a little nuanced, but just building on that, what if you're interviewing at an academic hospital? Perhaps you don't come from the most academic home institution, you haven't gotten basic science or wet lab research, and they say, "What are your future goals?" And you say, "Well," and genuinely in your heart, you want to be an academic surgeon, but you don't have that background. Would you advise students to say, that's not something I've gotten, but it's something I'm willing to learn? Or could that be perceived negatively that you don't have those experiences, but you're saying you want to go into it? What were your thoughts beyond that?
So once you get an interview, they want you.
Mm,
So once you get an interview at any institution, I think you're on a clean slate and they want you. So you don't have to be anyone that you're not. But I do think you just want to think about what your future practice is going to look like. And everybody knows that people change paths. Some people start as cardiac surgeons and then they're thoracic surgeons. And some people train at the number one program in the country and end up in a remote community practicing. But I think you just want to think about it. So there's never going to be a situation where somebody at a large academic institution is going to interview you and feel like you're not qualified, I think, right? Especially in integrated thoracic. So I think once you have that interview, you just want to really show your interviewers that you're really sincerely interested in their program, that you've done your research on their program, and why you want to train. And so I would say for integrated thoracic programs, like every institution that has an integrated thoracic program, I think the faculty are really committed to education, right? Because there's only 45 spots and what, 38 or 9 programs. We have a couple new ones this year.
mm,
So I think all of the programs, the faculty are really committed to education, and it's a 6-year program. And so I think you can assume that once you get an interview with how competitive it is, that you can just show them who you are and prove that you're a good fit for their program. You can also say an answer kind of like this, Adam, that says that you want to train at a very busy academic surgical program where you get exposed to all subspecialties. So you would assume that a very large program, you would, be extra busy. You would see congenital and structural and vascular and cardiac and all of the transplant and MCS stuff. So you can taper your answer that says, I want to learn everything. And that's a good answer.
ambitious one.
Yeah, yeah. Shows you're super motivated to just get in there and work.
Yeah, that makes sense. And yeah, we do want to be respectful of your time, but for all our viewers, we just wanted to touch on obviously interviews are very stressful, very tough, emotionally, mentally. Just any general tips you have just for staying grounded during this time, as you go through the weeks of traveling and feeling dejected and going on.
Do you feel dejected?
No, no, it's too early for me.
Oh, okay.
Then goes
Good,
on.
good, good.
It will come.
No, I mean, I think, gosh, it's a horrible process, right? I mean, I have students that I mentor through many different organizations and really all stars that I think really struggle. I mean, I have people that I talk to the night before the rank lists are due that just are just like so torn up. And I would say just acknowledge that it's a pretty crappy process, the whole interviewing, matching, ranking. And I think you feel out of control as a student. But I actually think that the students really have more control than the programs. That if you're really sincerely interested in a program and it's your dream program, I would say show them it's your dream program. Now, you don't have to be obnoxious about that, but I mean, I can tell you about a couple years of students that came through Utah that I wanted, right? But these were my students, and I was going to tell them to do what's best for them and what they wanted. And, two students came to me super torn up about, I don't know what to put number one. I don't know what to put number two. I don't know if I should go back for a second visit. And one of the students sent multiple email requests to go back for a second visit and got zero response. And on like the fourth email, I mean, I told her, I said, just tell him you're coming. Just tell him you're going to be in town. Tell him you've never been in that city and tell them, can you please come by and talk to people? And she did that and she matched there. And, it would be selfish of me as faculty to advise students of my preferences. And so I think you have to assume that you all really do have control of this horrible process. And if you really have a dream program and it's a really competitive program, I would say to go for it. Have faculty reach out for you, contact people to put good words in for you. Um, and then really just take care of yourself, like take time to do whatever it is that makes you have a little less stress. Go to the gym, go on a walk, play with your dog, hang out with a partner, whatever it is, you have to take a lot of time for yourself and realize that everybody knows it's just really hard.
Yeah. Well, thank you very much. I think a lot of us need to hear that and be mindful of it. So we really appreciate it.
Yeah, and you can go back to your mentors, Adam, and you can, I mean, all of the students, I think, in the integrated program match are brilliant. And I think that it's always surprising to me year after year, you know, to see the list of a very few people that didn't match. But I think when you go back to it, I think it's probably that they weren't assertive enough with having a broad list and playing their cards right. And I would really go back to the people that wrote your letters or whoever your support group is and just really ask people if they can reach out for you and give you advice again, kind of midway through and then before you turn your rank lists in. Because particularly in the integrated thoracic, I would say it's just a really small group of people that you're going to see at every single interview. All the faculty at all the programs know each other, right? And we all want what's best for all of our students.
Wonderful. I mean, thank you so much. I think we covered a lot of really helpful information for our students, and we can't thank you enough for continuing to support medical student education through these calls and initiatives. There was you did mention something new coming up for students for STS. Did you want to talk about that at all? Uh,
Oh yeah, I am excited about a new scholarship we have. We have a new scholarship called the STS You Belong Equity and Opportunity Scholarship. It's for medical students and general surgery residents to attend the STS meeting, and we're on a really tight time crunch. So we're hoping to have this out and posted by tomorrow with a application deadline of December 6th. But we do have 11 scholarships that we really want to give, sponsored by STS. And so um, Yeah, thank you. I think we would love to have a really diverse group of folks come to the meeting. That would also be in addition to the looking to the future. And um, there's a Women in Thoracic Surgery scholarship too. And I know that those aren't quite out there yet with the awardees, but they should be within a week or two.
Exciting stuff. Hope to see all
Yeah.
the students in LA this year. And
Yeah.
we look forward to seeing you there as well, Dr. Pereira.
Yeah. Thanks, Adam. You're great. And thanks to TSMA.
All right. Thank you, everyone, and be on the lookout for more interview tips coming up. Thank you.
Mhm.